So let's talk about hair removal. I'm gonna put it back over to you.
Okay, cool. Um, um, so hair removal, it really depends on the type of surgery one is having. For vaginoplasty, since we're thinking about using penile skin as well as scrotal skin, as well as some of the skin in the perineum that's behind the scrotum in front of the anus. So we'd like for that area to be completely devoid of hair. Depending on each individual person's pattern of hair growth, color of hair growth. For some individuals, laser may be appropriate. For some others, electrolysis would be needed. And then the number of sessions also varies. Some people are done with 6 sessions. Some people require like 20 sessions over a period of a year and a half. Um, if we are to do a peritoneal vaginoplasty, like a full vaginoplasty with peritoneal tissue, hair removal is not that critical because the inside lining of the vagina is now made of peritoneum. However, in the off chance that we are not able to complete that during the surgery itself, it's great to have like completely hairless skin on the penis and the scrotum area so that we can modify things as needed
As a backup.
as a backup yeah. um, for phalloplasty, uh, if you're choosing to have a urethra placed, then the area of the urethra has to be completely hairless, no exceptions, zero hair. And you have to give it several months after your last session to make sure pesky little hair follicles don't grow up. Typically, patients who are getting hair removal, for instance, on their forearm, will get hair removal not just along where the urethra is, but all over, because for some people, having a hairy penis is okay, but for many people, they're like, yeah, it's, it's not a thing. Um, but if you choose to have only the urethra part done, depending on the kind of phalloplasty you're having, depending on kind of the urethra you're having, different parts of the forearm are used. What I typically tell folks is just the volar surface or the front surface of the forearm, which is from here to here, just get this all zapped. And typically this side, which is the ulnar side, which is where the ulnar bone is less hairy, but there are still some hair follicles right around here. So, get that area zapped. And this side, in case we have to put the urethra somewhere around here, then having this area clean also helps. So just, draw a line from here to here, like so, and get it zapped, and that should do the trick. If we are having an ALT and ALT phalloplasty with a urethra, then obviously the thigh area has to be completely hair-free. Um, Typically for phalloplasty, urethroplasty, hair removal, they are more involved, intensive, not only because we require complete removal of hair, but also because these folks have been on testosterone. Testosterone causes massive hair growth, and it's not just the volume of hair; it's how thick that hair, the texture, how that responds to electrolysis or laser. So you definitely want to get a head start on that.